I am going to talk to you guys about respiratory infections. They occur in many species, including humans. In cats, feline herpes virus type 1 commonly causes upper respiratory infections. Upper respiratory infections in humans range from the common cold to tonsillitis. In rats, stress and poor ventilation in their environment can cause mycoplasmosis, which is an upper respiratory infection. In captive reptiles, upper respiratory infections are the most commonly encountered disease. Improper husbandry is the main cause of upper respiratory infections in snakes because it leads to stress. High stress compromises the immune system and its responses to pathogens. Improper husbandry includes too low or high of temperatures, inadequate humidity, and poor nutrition. Different species have their own habitat requirements. Species like the Sumatran short-tailed python and spotted python like humidity between 60 and 70%. However, the Kenyan sand boa needs a dry environment of about 30% humidity. Western hognoses prefer 30 to 50% humidity. Upper respiratory infections in snakes can be caused by many different pathogenic isolates, but gram-negative bacteria are the most common. When the animal becomes stressed, those bacteria, which naturally occur in their bodies, are able to infect their upper respiratory tracts. Sepsis also can cause upper respiratory infections. Sepsis can occur from injuries, mouth rot, and also scale rot. Clinical signs of upper respiratory infections in snakes include excess mucus in the mouth, nasal discharge, loss of appetite, lethargy, wheezing, and in severe cases, open mouth breathing and gurgling. Mucus is produced in response to inflammation. To properly manage and cure an upper respiratory infection in snakes, you need to assess the animal's environment, check temperatures and humidity. Make sure the substrate is safe and works well for the species you have. Make sure there is a proper temperature gradient along the enclosure to allow for temperature regulation. Snakes are ectothermic, thus they cannot regulate their temps internally like mammals can. After assessing and correcting environmental concerns, you want to bring your snake to a veterinarian. The vet will likely run a culture and select the proper antibiotic that will work against the bacteria causing the infection. A proper environment with limited stress and an antibiotic treatment will most likely correct the upper respiratory infection. If the upper respiratory infection was severe, there could be permanent lung damage causing an audible clicking sound when the snake breathes. It is important to catch an upper respiratory infection fast to prevent the possibility of permanent tissue damage. Thank you for listening in. My name is Leah Simulus.